Okay. Thank you very much, and thank you much for Netta and for HiTest to sponsor this talk. And as she said, I'm going to speak a lot about acute phase proteins, mainly about C-reactive protein in dogs. It's an area I've been working on for about 30 years or more, and it's what I hope to do is to produce or to identify or give you insights into why it's a valuable diagnostic test to be used. It is the analysis of acute phase proteins has been, or the use of it is varied according to different countries. In some countries like Japan, it's a very common test. It's in the profile of the clinical biochemistry workup. In Europe, we're moving into that stage, and some countries are more advanced than others. But I know in North America and the States, there is some lack of knowledge maybe that's not being able to, the reason why it hasn't been so well developed as a useful test. So what I'm going to do today, first of all, to give some background into these acute phase proteins. As was stated, I am a biochemist, so I'm afraid there will be some biochemistry in there to give you some background onto the proteins and their functions. Then go on to look at how the measuring of the acute phase proteins for veterinary diagnostics has developed over the last few decades. Then some examples of research studies that have generated the information that shows how the acute phase changes in various clinical conditions. Then a short section then on what the value or why it would be useful to measure these biomarkers in routine veterinary medicine in your practices, and then a final section on the future prospects of acute phase protein analysis in veterinary medicine and things that are happening now and things that might happen in the near future as to take the field further forward. So first of all, the acute phase proteins, I actually first came across this in about the 1980s, and this is the first major publication I had. Is a review of the acute phase proteins in cattle and dogs at that time point. And essentially at that time there was only about 20 papers that we reviewed, maybe only about 4 or 5 papers on the occurrence of C-reactive protein, and that was partly scientific and very little in terms of their diagnostic potentials. But since that review, there's been several further reviews, most of which have had, well, these examples I've co-authored, but these aren't the only ones. In fact, one of the best reviews of the area is from Dr. Carolyn Cray, who's actually from Miami. Unfortunately, she couldn't be here. I did ask her if she was going to be coming to the meeting to have some discussion with her. But if you want to further information about acute phase and what is happening across here in the United States, Carolyn Cray at Miami would be a very good contact to start with, although she actually has expanded beyond small animals. She actually works a lot in exotic species and wild animals, because these markers can be used across a wide range of species. Okay, so what is the acute phase response, and what is it? And where do the acute phase proteins come from? And this actually partly explains why I think that the area has been less researched than otherwise, because although the stimulation of the acute phase via inflammation, infection, and particularly endotoxin from bacterial infections, well known to stimulate the production of the pro-inflammatory cytokines, and the cytokines have local effects on neutrophils and phagocytes, and that area would really be taught to vet students by the immunology department or the immunologists. The acute phase response I'm talking about is more a metabolic response or a protein level response, and that's an area that, because it's not linking into either the microbiology or the immunologist areas of expertise, it has been substantially understudied. And yet this systemic acute phase response, which is part of the innate immune system, actually causes effects on many different tissues. So we have, let's say starting this side, the brain is affected, which causes the fever that's part of the acute phase reaction. Muscle starts to degrade to provide fuel for combating disease, so that the amino acids can be used for fuel. Adipose tissue are also being mobilized to provide fuel for fighting the infection. And the liver goes through a very substantial metabolic change. And one of the biggest aspects of that is that there's a shift of protein synthesis from proteins like albumin, which decreases in synthesis and secretion, to the acute phase proteins, which are then secreted from the liver and into the bloodstream, where we measure them as part of our diagnostic workup. So just to focus then on just that changes in the liver. So again, infection, LPS, or inflammation, causing monocytes, macrophages, produce pro-inflammatory cytokines, and in the liver they produce the acute phase proteins. And these are 4 examples that I'll expand on: haptoglobin, serum amyloid A, alpha-1 acid-glycoprotein, and C-reactive protein. So these are just 4 of, and it's mentioned that I'm now working in proteomics, and from proteomics we now find there's many more different proteins that we could call acute phase proteins, but in terms of diagnostics, these will be the 4 I'll be focusing on in this presentation. Okay, so when we started looking at the acute phase reaction, we've found that there are big differences between species in how they react, which I'll show shortly. But in any one species, there are proteins that have these different types of profiles of reactions. You have a major acute phase protein in the purple line, and that is a protein that is virtually absent or at very low concentrations in the healthy animal. It will increase maybe even 1,000-fold within 24 or 48 hours of the response taking hold following the pro-inflammatory cytokine induction. Then there's the moderate acute phase proteins, which maybe increase about 10-fold, and they are proteins that will be measured in the serum of a healthy animal. There are minor acute phase proteins, which maybe double in their concentration, and not to forget, there are negative acute phase proteins, which actually decrease following the inflammatory response. What I'll be talking about will mainly be the major and the moderate acute phase proteins, because the size of their increase gives valuable diagnostic information. So this summarizes the species differences in the acute phase proteins and the different major, moderate, minor, and negative acute phase proteins that we study. The top 4 are the ones that I said I'd be talking about most. In red are what I would call the primary acute phase. If you were a clinician and you wanted to just measure one acute phase protein, those are the ones I would measure in the particular species. Serum amyloid A is a major in just about all species. There are some problems in its assay. It's quite a strange sort of protein. It has some odd biochemical activities, which makes it difficult to measure. So it would be a major one in bovine if it wasn't for haptoglobin, which is also has a very big response in ruminants and is much more easy to measure. It's a fairly standard type of immunoassay, or even a biochemical methodology. So serum amyloid A, it is a major acute phase protein in most species. Haptoglobin has this effect in cattle in particular, but also sheep, of being absent normally, but increasing to quite high levels. Whereas in other species, it's more of a moderate. It is present in the healthy animal. Alpha-1 acid-glycoprotein, there's a specific function or use of alpha-1 acid-glycoprotein in the cat, which I'll describe later on. And that's on twice, because up to about 2 or 3 years ago, I would have said that AGP was the best marker in cats, but SAA methodology has developed, so it is more easy to measure. Then in dogs, as most I'll be talking about today, will be that C-reactive protein is the major acute phase protein in dogs. Now, if any of you have medical friends, or if you ask your local clinician, your physician, what about CRP? In man, CRP is the acute phase protein of choice. It's been an acute phase protein that's been measured for 50 years or longer, and it's a very and if you do speak to a physician, they'll probably say, well, if you can measure CRP in dogs, why don't you? Because if it's as good as it is in humans, it should be a regular test to be used, and just in many times in a week or a month. So canine CRP is very much like human CRP. Okay, just some of the science or the biochemistry of these proteins. So acute C-reactive protein, it's a pentraxin because it has this 5-membered ring. It's by function, it's been shown to bind to a certain number of chemical substances, such as phosphatidylcholine and the nucleic acids. Also binds C polysaccharide or gram-positive bacteria, and that's where its name comes from, the C-reactive protein. And when it does that, it can activate complement, lyse the bacteria. For the nucleic acids, it binds those and scavenges them. And as I've said, it's acute phase protein in dogs, pigs and man, but not in some of the other species. And it's like just repeating that. Various effects it has on phosphatidylcholine. It can activate complement for the gram-positive bacteria, and also scavenges for DNA. So some of the activities have been established. And as for other acute phase proteins, on the basic biological level, there are other functions being accrued to CRP as we go through. Haptoglobin, this is the molecule that in ruminants is absent in the healthy animal. It's basically 4 subunits, 2 alpha and 2 beta subunits. This diagram shows the alpha subunit and the beta subunit. In ruminants, as well as having that difference in the profile, it actually circulates as a very high molecular weight polymer of over 1 million molecular weight, which may explain why it's a major acute phase protein. It's only moderate in other species. This here is quite important for the dog, in that cortisol, whether endogenous or being given as a steroid for treatment, does actually induce haptoglobin. So that does complicate the analysis. Although there are studies in Europe that have indicated that measuring haptoglobin can be used in defining Cushing syndrome because it does change in that disease. The major function is to bind very strongly to hemoglobin, and that's actually the basis of a method we developed a long time ago for measuring haptoglobin very easily, and it can be used as a routine analysis. So these are some of the functions of the haptoglobin. It binds hemoglobin, has various other activities which can be attributed or found in the journal, in the review by Fabrizio Siciliani. But I'll skip on to serum amyloid A. I said in some ways it's a bit of an odd protein. It's quite difficult to work with. It's highly conserved in most species, except the rat, I think, is the only species that hasn't been identified in. So small protein. You get 3 or 4 isoforms in most species that have been investigated. It has hydrophobic interactions, and in the circulation it binds to high-density lipoprotein, which can cause problems in measurement. It has antibacterial activity, particularly on gram-negative bacteria. It does stimulate the synthesis of mucins and reduce diarrhea in neonates. This actually would be part of another talk normally, because we've looked at serum amyloid A in milk, particularly in colostrum, and there it has been shown to have some antibacterial effects on the neonatal digestive tract. The one problem with this is that the amyloid A, or serum amyloid A, is the precursor of amyloid A and amyloidosis, so they can have some pathological effects as well. And these are just a diagram of what I've been saying. It affects mucins, it scavenges cholesterol as part of its interaction with HDL, optimizes bacteria, and also has some effects on the white cells. Alpha-glycoprotein, it's very highly glycosylated, very soluble. Again, it has many isoforms because the carbohydrate groups can vary. That glycosylation can change during the acute phase reaction, and in humans there are groups looking at that change in glycosylation for diagnostic purposes, but it's very expensive, and I don't think it's going to become a routine test even in humans. It binds certain drugs, and it has various effects on, again, on the immune cells, and it can have some antibacterial effects. So therefore, AGP has various effects on neutrophils and phagocytes, and also does have some effects on drug binding. The major function is still in debate of AGP. Okay, so switching on from the basic outline of the acute phase proteins, more a short review of what progress we've been making or has been made in measuring them. Okay, and this is over the last 3 decades work that we've been involved in this work in acute phase proteins. The 1980s was a time when just a few groups were involved in this and were trying to identify and characterize and see if they can be used for diagnostics. Ourselves in the UK were one group doing that, but another major center was in Japan, in the University of Hokkaido, where Professor Naiki developed a lot of interest, and he was more successful in getting it out into clinical use, and that's why in Japan looking at CRP is a much more common test than it is anywhere else in the world. In the 1990s, there was a few more groups becoming active, particularly in Europe. And at that stage, the methods that were being used were either being developed, were mostly being used that they were developed in-house. So people developing their own antisera and developing methods that can be used for analyzing samples. From about 2000, other assays became more commonly used, particularly for C-reactive protein. It was found that some of the assays for human CRP would work in dogs. So there's a big increase in analysis using methods that could apply to humans. There's lots of disadvantages, and probably in the last, from about 2010 approximately, reagents became more available for species-specific acute phase proteins. So canine CRP is now, or can be now measured in a species-specific immunoassays. So the methodology, immunoassays are the major type of methodology, so requiring, if preferable, a species-specific antibody. Lots of different formats of immunoassay have been applied to acute phase proteins, starting from radial immunodiffusion. The older members of the audience may remember those. It basically takes 48 hours to get a test to be developed, but they can be very useful for measuring the proteins. ELISA systems allow high throughput number of samples, but still take 3 or 4 hours to process, so not really good for a diagnostic laboratory. Immunoturbidimetry is the method that's used in human clinical biochemistry to measure proteins, and they can, with an automated system, can analyze, depending on the machine, basically up to 400 tests an hour could be run on some machines. So immunoturbidimetry would be the method of choice for diagnostic laboratories that have lots of samples. These four magnetic binding immunoassays, spatial proximity, the dry immunochemistry systems, and lateral flow. Basically, these are all tests that are or can be developed for use in a practice. So it is coming to the stage where a practice laboratory or in practice or point of care systems are becoming available. Whereas the immunoturbidimetry and the haptoglobin assay that we developed and has been commercialized is a test that can be used on a biochemical analyzer and is therefore of potentially usable in diagnostic laboratories. Just to say that the immunoturbidimetry test for C-reactive protein, we actually developed it ourselves in Glasgow in 1991. So we had this test going 28 years ago, which shows probably my sort of one of my failures is that hasn't been available or wasn't. Or I suppose then the diagnostic companies at that time weren't so keen at taking it up. But now These are just 4 examples of commercial CRP assays. 3 of them are based on that immunoturbidimetric system, and this one is a more of a different type of system. It's a magnetic, has a magnetic particles which allow an in-practice system to be developed. So there are these assays are available, and I'm sure if the clinicians amongst you are interested and ask your diagnostic laboratory, they should be able to source these assays relatively easily. And this is just, it's probably not a complete list, but this is a list of manufacturers that do produce acute phase assays. HiTest I put at the top because they sponsored me, and but they are more of a reagent generator. But Gentian is probably the commonest test used in Europe nowadays. They've been going for about 5 or 6 years. Tridelta from Ireland have developed a number of systems. The Spanish. There's Life Diagnostics also in America, but they've been specializing on ELISA and this Sparkle assay. IDEX have got a CRP. It's being sold in Japan and in Europe, but speaking to them the other day, they're saying that they don't have very high sales in America yet, but it is available on their Catalyst system. And there's other systems that have been developed. So now moving on to pardon me, on to look at some of the applications or some of the research that has been developed. Sorry. Just excuse me a moment, I've got some. Sorry about that. Sorry about that. I had quite a bad cold over Christmas, and it's not quite gone away yet. So the first example, steroid-induced steroid-responsive Meningitis-Arteritis that we looked at a few years ago in Glasgow. A presentation, CRP and SAA both elevated, and this is a theme that should come through. This is the use of the acute phase proteins to monitor treatment. So here's remission and resolution. Both of the acute phase proteins were reduced a lot by 2 weeks, and then 4 weeks at remission were very low. So monitoring the effect of therapy is one of the big functions or potential uses of the acute phase proteins. And this is compared to IgA, which at the time was being suggested as a diagnostic test for SRMA. And you can see here that the levels are only starting to be reduced by the 4-week period. A much more recent publication looked at the CRP levels in bacterial pneumonia. And these are in dogs that were either hospitalized for 2 days or for greater than 2 days, so basically characterized as a less severe and more severe type of infection with pneumonia. And this chart on the side here, the crosses represent continual daily samples from the dogs with the more severe, and the circles and the straight line are for less severe. So you can see it's monitoring the responses to bacteria. Very interestingly, in the paper, they looked at using the acute phase protein as a monitor for when to stop providing or withdrawing the antibiotics that are being used. So 8 of the dogs, the antibiotics were withdrawn between 5 and 7 days after the CRP, and they also measured SAA after they had come back to the normal levels. Whereas they also compared that to 9 dogs in which the antibiotic regimen carried out for the recommended 35 days. And there's no difference in the recovery. So using the acute phase response as a means of detecting when the bacterial infection had cleared is one of the further applications is possible. A bit similar in the terms of prognosis. This is a case of pancreatitis being investigated, identifying or looking to see the levels of the acute phase in dogs that either survived or didn't survive the pancreatitis. And you can see at day 3 and day 4, those that survived had significantly lower levels of CRP than the dogs that were unfortunately didn't survive the pancreatic. So it's giving you some indication of the level of the undergoing innate immune response and how it can be used for estimating the type of outcome of the cases. Just a minor point here is that in this graph, this is a Japanese group, and the units they used was milligrams per demiliter, which most other publications, particularly from Europe, are in grams or in milligrams per liter. It's just to demonstrate that in comparison to the other results I'm showing, this is quite a major response. So in other graphs, this would be 100 and 200, which are the typical levels of a major acute phase reaction. Now, just a further in-house study that we did in Glasgow, looking at intensive care patients to demonstrate one potential use. We haven't actually published this, but this is a study where we looked at animals or dogs in an intensive care unit, looked at 15 animals that survived and 5 animals that were unfortunately euthanized or died by the end of the study. And it's a bit difficult to have a same timeline because the samples were all we're only allowed to take samples from that are required for clinical evaluation. So we couldn't do a daily bleed of these animals because of ethical considerations. But if we take the first time point and the second time point in these studies, just to show the changes, the 15 animals that survived, all except one, had reducing levels of C-reactive protein, and the 5 that didn't survive had increasing levels. And if you're going back to the human clinical biochemistry, the use of CRP in hospitals, evaluating post-surgery or any condition in hospital, if the CRP levels of a human patient are increasing, that's a major flag for the clinicians that there's some problem occurring. So basically, that would be the same in dogs if we looked further into that area. And in surgery, as I said, in human hospitals, in post-surgery, CRP is often measured to monitor the progress. This is just to demonstrate that surgery in dogs of either ovariohysterectomy or ovarioectomy, the main function of the study was to see if there's any difference in the level of the post-surgery acute phase. But you can see from this graph that at least up until 24 hours, there's no difference between the two types of surgery. It's a bit similar, this study of another surgical operation with tibial plateau leveling osteotomy. But here the 3 lines in blue are animals that responded well post-surgery. The 2 lines in red are animals in which there was evidence of soft tissue infection. So in other words, using the acute phase could give you an early indication that there was some complication occurring and that the possibilities of further intervention may be needed. Infectious diseases do cause acute phase reactions. An example from a group in Turkey actually just showing Parvovirus infection caused a big increase in Haptoglobin, in C-reactive protein, going from a very basic level. Interesting here, I haven't mentioned it, but I mentioned at the start that albumin is a negative acute phase protein. So levels of albumin do decrease in this infection. And ceruloplasmin, I didn't mention at the start, but some ceruloplasmin is also a moderate acute phase protein, so it can be measured in some situations. Some colleagues of mine in Spain did a lot of work on leishmania, an infection with Leishmania infantum. Basically, the outcome of this study of looking at both healthy animals and asymptomatic and symptomatic dogs with infection is that CRP in particular can show you a difference between the asymptomatic and the symptomatic, which is quite an important differential diagnosis. And although that study was done in 2002, the group in Murcia in Spain have done a lot more work on that to make the analysis of the acute phase proteins very, very valuable in the workup of leishmania patients, which is a very important disease in the Mediterranean area. I've been speaking mostly about dogs, but there is one example I want to give on cats. And this is some work we did quite a long time ago with the Feline virus laboratory in Glasgow, looking at feline infectious peritonitis. We basically found that in FIP, levels of AGP were very much higher than in any other condition we looked at. So this is basically comparing healthy animals to animals with FIP, then animals with, or cats with similar symptoms, but were then shown to be non-FIP. And you can see that above a level of 1.5 grams per litre of AGP, it became fairly diagnostic for FIP, and since then that has been part of the workup in Glasgow for diagnosis of FIP in cats. It was supported by the group in Milan in Italy, have measured not just the alpha-linoleukin which basically confirmed the results we'd shown in Glasgow, but also they looked at haptoglobin and serum amyloid A. Serum amyloid A is giving a very much higher level in the FIP, but as I said earlier, the SAA methodology can be a lot more difficult, and that's why the SAA would not have been promoted as a diagnostic test at that time, although there are methods nowadays that have, in the last 2 or 3 years, have come onto the market to be able to measure feline SAA on a regular biochemical analyzer. So just to summarize, just to mention the acute phase in cats, so it's not just that we're looking at. So AGP is a good additional test, not by itself, but it's an additional to the workup in FIP. It has helped the group in Glasgow, who are quite an established research group on feline virus diseases, to help diagnose their FIP cases. But now that we do also have immunotherapeutic methods to measure feline SAA that could be applied, and feline SAA is the, would say would be the primary acute phase protein in cats, but we haven't had much in the way of clinical evidence yet to give the precise applications. In horses, for a while it's been known that SAA in horses is the major acute phase protein, and it can actually rise to very high levels in terms of the scale of the response. There are immunometric assays that can be done in the laboratory. There are also lateral flow methods that can be used, for instance, in a practice or even at a stable. And in the UK, and I believe in the States as well, the SAA is being used in thoroughbred training to identify either the presence of subclinical illness or other conditions that might affect the training process. Okay, so now moving on to the value, or what's the point of doing these? I hope you're picking up some of these from what I've been saying about the investigations. Very early on, when I was looking at the acute phase, there's a quote from, he was then just Professor Mark Pepys, but he's now Sir Mark Pepys. He's been knighted by the Queen of England for his contributions to medicine, which are essentially the development of C-reactive protein in human diagnostics. And basically, he when he was trying to educate the clinicians and human clinicians as to why CRP should be used, basically called it a molecular thermometer. And that's essentially what it is. I mean, the temperature is controlled by the same system, but it's actually under much tighter control. The temperature will go up and come down fairly quickly, whereas the acute phase proteins aren't under the same amount of control, so they will give you a more long-lasting response. And also the scale is much bigger. Some of them can be 1,000-fold increases, so you can monitor and judge the respective level of the acute phase. We have with a colleague, Beth Schmidt, who's actually from Brazil, but we've done a lot of work with her. We have looked at, this is basically, so there are enough publications now to look at the applications through essentially meta-analysis We have done these flow charts, but they're probably not what you want at the moment when you're just starting out to look at acute phase. But you can see that there have been lots of investigations here of infections, and that's the paper we published it in, but also in neoplastic diseases where you do get change. I've not really mentioned the levels of change that do occur, but in various types of neoplastic disease, the acute phase proteins do change, and there are studies that we've published through Glasgow, through the oncologists there, that show the value of measuring the acute phase in neoplastic disease. This may be probably the most important if you're just starting to look at CRP. This is from a paper by a good friend of mine, Jose Serum, Professor of Clinical Pathology in the University of Murcia in Spain. He's done a lot of work on clinical applications, so if you're interested, his papers would be of great importance to read. But this is basically his interpretation of, say, a sample that's been gone through, had CRP measured. It's not really sure what is the cause of it. But essentially, from 0 to 12 milligrams per liter, you'd say that would be a normal, healthy animal. 12 to 20 would be a slight increase, indicating mild inflammation. Maybe some uncomplicated diseases, gastrointestinal or nasal diseases. Above 20 to 40, this is a mild inflammation, where there may be some viral diseases tend to give lower responses than bacteria. So that's why he would say that up to 40 maybe a viral disease. 40 to 100, that's a marked or a moderate inflammation. It's got some particular conditions that may be causing that level of response. And then the very high levels of greater than 100, you get severe inflammation, could be septicemia, or there are some other immune-mediated disorders that have been shown to have those very high levels. But essentially, the interpretation is that the higher the level, the bigger the problem, and the bigger the inflammation. So, just essentially to summarize some of those reasons why the C-reactive protein and other acute phase proteins would be useful. First of all, it's the detection of systemic inflammation, and that particular can possibly, if that caused by infection. It's sensitive, but it's not specific. That's one of the big drawbacks, or what people criticize the acute phase for. It's not specific. If they're interested in one condition, then they may increase. But it's not. You can't. It's difficult to differentiate it. So it always has to be to be tied up with other methods for identifying the specific disease. But it does give you that level of knowledge about how high the innate immune response and the acute phase response has been stimulated, whether it's a very high response or it's giving you a subclinical level of infection. And then I hope I've shown in some of those examples that monitoring the treatment is one of a very, very informative way of using the acute phase. It's shouldn't be just measured on first presentation, but on follow-up as well, and potentially of establishing a time to cease treatment, which in these days when then the sort of big problems of antimicrobial use and resistance are growing up, then knowing when to stop treatment with an antibiotic could be very valuable. Okay, so this finally into the sort of the future, what we're sort of thinking of is the potential or what's sort of happening in the acute phase world. So the current prospects are that it is now possible for any clinical pathology laboratory to be able to purchase methodologies that will run the major acute phase proteins of most species, and if you think it's valuable, then you should be asking the laboratory that runs your samples and asking them why they're not running CRP in dogs in particular. Because that basically what's happened in Japan first, it's happening now in Europe, that more people are using the acute phase proteins, they're getting more experience, they're finding out the benefits and also the limitations of when it's not going to give you a specific diagnosis. Also, there are in practice methodologies coming through, so you don't have to send a sample off to a faraway diagnostic laboratory. In the future prospects, some of the things I see coming through that might be that methodologies are measuring samples in the clinical ranges it's potentially that using a higher sensitivity, you may be able to see some changes at the lower end. What we think are healthy samples now may actually be subclinical or preclinical cases. So there could be a potential for looking at high sensitive methodologies. Also multiplexing, in the near future it might be possible to measure 4 or 5 acute phase proteins or other biomarkers and use algorithms to be more specific or maybe make them more specific on the in diagnosis of particular diseases. There's some need to agree on clinical cutoff points, and this is one problem that's facing the people producing these kits, because it'd be important to harmonize standard calibration. And this has basically been caused historically by different laboratories producing different methods with their own standards, and sometimes they don't agree with each other. Then you've got several manufacturers as well. And currently there's no really commonly accepted standard, but we are I've been starting discussion as to how that can be addressed, so it might be that they may become possible in the future. And to summarize, for CRP and the other acute phase proteins, they're biomarkers for inflammatory, infectious, and neoplastic diseases. They're highly sensitive, but they're not specific for one particular disease. They're now available for dogs, for canine CRP, but also they are available also for cats, horses, also cattle. I could have given another 45-minute talk on the acute phase in cattle, but that could be another day. But basically, it is probable, my prediction, that with the experience gained, they will become a very common component of the biochemistry workup in diagnostics into the future. I'd just like to acknowledge High Test for bringing me here. Jose Serum and Mads Kjeldrup Hansen, probably Jose in Mercia, Mads in Copenhagen are probably the two major investigators working on the animal acute phase proteins. So do check out their papers if you want to see more particularly about sort of clinical applications. And other my collaborators in Glasgow, other people that have our sort of funded our research in various areas, and some of the funders down here. So thank you very much.
Are there any questions? Don't forget that High Test left a lot of wonderful materials here that you can take with you on Professor's talk. Thank you.